So when it comes to leptospirosis and acute kidney injury, most people in veterinary school 10 to 20 years ago were taught that the azotemic icteric dog was classically canine leptospirosis, and it's probably from Leptospira icterohemorrhagica. That has changed. Unfortunately, what we're seeing now is 80% of the time it's just acute kidney injury. Rarely do they actually have a secondary hepatopathy. I would say about 10 to 20% of the time will we see both the azotemic patient and the jaundice patient with increased liver enzymes. So leptospirosis should be one of your top differentials whenever you see a patient that's azotemic, that has acute kidney injury, that's PUPD, that's lethargic, and again, 80% of the time it's just acute kidney injury that we're seeing. In terms of what I warn owners about, I do warn owners about the zoonotic risk. It unfortunately is the #1 zoonotic disease seen in the world. And so over 1 million people are diagnosed with leptospirosis. And this is honestly in the Caribbean, Hawaii, India, China, some other countries. So less common in North America, but definitely something that we worry about. It's exposure through urine or blood or through tissue. So I always tell people, if you are worried you're seeing an azotemic, ain't doing right, or ADR patient in the hospital, make sure you're using gloves or appropriate PPE to protect you and your staff. The likelihood of transmission to pet owners is pretty rare, honestly, and that's because leptospirosis is eliminated once we start them on appropriate antibiotic therapy. So still a risk to pet owners. I always say contact your medical doctor if you're concerned, but for the most part, risk is pretty rare, but it's still the #1 zoonotic risk, zoonotic disease that I worry about.